Good afternoon. My name is Dr. Leslie MacInnes, and I'm a physician at the Falls Pediatrics. At Falls Pediatrics, we aim to build long-lasting relationships with your family by being entrusted with the care of your child. In today's family-friendly video, I will share information on vaccines. Vaccines are vital for the health of your child, but also for the health of the community. We have safe and effective vaccines that prevent illnesses that can have long-term consequences or even lead to death. Starting during infancy, children are building their immunity to diseases through routine vaccinations. Vaccines help prevent diseases that are not seen commonly in developed nations due to the success of our childhood vaccination programs, and they include polio, diphtheria, tetanus, rubella, and mumps. While many of these illnesses are uncommon, they can have devastating effects. For example, if a pregnant mother were to get rubella, it can lead to the death of the fetus. Diphtheria and tetanus can make it so someone cannot breathe and they can die quickly from that. And mumps can lead to infertility. Vaccines also help prevent against bacteria like pneumococcus, Haemophilus, and meningitis that can lead to a severe brain infection, which can cause loss of limbs, hearing loss, seizures, and even death. Vaccines can also protect against viruses like hepatitis B and the human papillomavirus that can lead to cancers. Vaccines can help prevent serious diarrheal illnesses like hepatitis A and rotavirus. And routine vaccination against varicella or chickenpox has helped reduce the incidence of shingles later in life. And we are starting to see the devastating consequences of what happens when some members of the community do not get the recommended vaccines, with the resurgence of pertussis or whooping cough and measles. There are some populations of children and adults who cannot receive the recommended vaccinations, whether due to age or illnesses like cancer. That is why it's so important for everyone who is able to get the recommended vaccines do so to help protect our vulnerable community members. According to the Caldwell County school requirements for entering kindergarten, children must be fully immunized against diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, Haemophilus, hepatitis B, and varicella. These vaccines can be completed when a child turns 4 years old. Requirements for entering 7th grade are the ones I mentioned previous, along with a tetanus and pertussis booster and a meningitis vaccine. And we also strongly recommend getting the HPV vaccine. We recommend these vaccines for starting 7th grade can be given as early as 11 years old to go ahead and get them out of the way. At 16 years old, we recommend a booster dose for the meningococcus, along with a second series for a specific strain of meningococcus that is especially prevalent among healthy teenagers and young adults, and it spreads rapidly in college communities. We also strongly recommend that everyone get a yearly influenza vaccine. There is a lot of misinformation about vaccines available online, so if you ever have questions or concerns about vaccines, you can speak with your child's primary care provider or visit the CDC website for the most up-to-date and accurate information about vaccines. In closing, at the Falls Pediatrics, we are honored to be a healthcare provider of choice for your child, delivering the healthcare we expect to our own family. Have a pleasant day.